student nurse today. Can you verify your name and date of birth for me, please? Okay. I'm going to check it with the orders and it matches. All right, Mr. Johnson, we are going to be inserting a Indwelling Foley catheter today. And that is going to be a tube that's going to go through your urethra into your bladder, and it's going to help you void better. So do you have any allergies such as iodine, betadine, or latex? No? Okay, great. So I'm going to go ahead and raise the bed up to working height. And since he is a male, we're going to keep him in the supine position and with his thighs slightly apart. Okay, we're in good position. I'm going to go and wash my hands again, and I'm going to go ahead and put on clean gloves. And I'm going to start the perineal care. And we're just going to clean the area where we're going to put in the catheter, and that way it's going to be nice and clean. So I'm going to be using mild soap and water with a washcloth. So we're going to go ahead and uncover you, Mr. Johnson. Okay, I'm going to lift up your gown. So for perineal care, the mild soap and water, and I'm going to do it in circular motions around the glans penis, and I'm going to do long strokes down the shaft. Okay, so now we're all done with perineal care and you're all clean. Go ahead and put that up, and I'm going to go ahead and take off my gloves. I'm going to wash my hands again, and now we're going to move on to sterile gloving. Okay, so at any time if I break the sterile field, I'm going to start over with a whole new kit and gloves. Set up my strap bag. Get my gloves. I'm only going to touch the 1-inch border around the sides. I'm going to take my non-dominant hand. I'm going to insert my thumb side up. Okay. I'm going to take my dominant hand and I'm going to now I'm going to knock this off. I'm going to go ahead and place the pad shiny side down on the patient. I'll lay it across the thighs. Keep my hands above my waist. And now I'm going to move the sterile field onto the edge of the bed. Okay. First thing I'm going to do is I'm going to uncap my water for the balloon. I'm going to attach it to the port. Put it back in the bag. I'm going to pour out my betadine. I'm going to discard of it in the trash bag. I'm going to do this 3 times. I'm going to take the cotton ball, dip it in the betadine, and then once I put my hand on the penis, I'm not allowed to remove it. So I'm going to do circular motions and drop. Dip it in the betadine, another circular motion and drop, and another circular motion and then drop. So now that the penis is all clean, I'm going to discard of this, and I'm going to insert the lube. I'm going to take the cap off. I'm going to be inserting this into your penis, and it's going to help the tube go into your urethra. So I'm going to inject all of the lube into the penis, and then I'm going to discard of that. And now that we're all lubed up and clean and dry, I'm going to insert the tube, making sure not to touch anything else. I'm going to go ahead and insert the tube. This is going to be kind of uncomfortable, but we're going to get through this. If you need to take a break, you just let me know. Okay, so I'm going to go ahead and insert the tube. I'm going to insert the tube all the way to the Y, and when urine comes out, that's when we know that it's in the proper place. Okay, and for this mannequin, it's kind of hard to push the tube down, and since we can't use actual lube, I'm just going to pretend I got it all the way to the Y. And then once the tube is in place and urine is coming out, that is when I'm going to take the tube, and we're going to tape it to the abdomen since he's a male. I'm going to tape it to the abdomen. Now that it's properly placed and still, I'm going to go ahead and inflate the balloon, 10 milliliters of saline. Okay, inserted that. So I'm going to take it out without releasing the pressure in the tube. I'm going to discard that. And now once it's perfectly in place and it is taped to the abdomen, I'm going to attach it to the bed. I'm going to make sure to do it on the actual bed and not the handrail. Okay, so once I have it attached to the bed, I'm going to go ahead and use a syringe. I'm going to plug it into this port here, and I'm going to take out a urine sample. Okay, once I got my urine sample, I'm going to put it in this container. I'm going to put the cap on, and I'm going to label it, and we're going to send it off to lab. Okay. So once I sent off the urine specimen, I am going to get my mild soap and water again, and I'm going to clean the area that had the betadine on it in circular motions, and then I'm going to discard of that. Now once that is done, I'm going to clean up my materials, and I'm going to make sure that the bed rails are up. I'm going to put him in the lowest position and make sure that he's comfortable and has no questions, concerns, or anything like that. Okay, so once I'm done with that, I'm going to exit the room, get rid of my gloves. Okay, I'm going to insert the room again. Hi, Mr. Johnson. I'm Savannah. I'm going to be taking out your tube today since we don't need it anymore. Would you like to verify your name and date of birth for me? Okay, I'm going to check it with the orders. Yes, we are taking out the tube today. That is awesome. So, I'm going to, first I'm going to drain the bag. I'm going to get my basin. And I'm going to unclip that from the bed. And I'm going to unclamp the tube. Okay. And I'm going to empty the bag into the basin, and I'm going to reinsert the tube. Okay. And the reason we did the urine specimen from the port is because this bag is no longer sterile once the urine touches the bag. Okay, so now that the urine is out, I'm going to untape this from your abdomen. Okay. And now we're gonna take out the tube, so it's gonna be a little uncomfortable. But like I said, if you need me to stop, I can. If you need to take a break, we can. So I'm gonna gently remove the tube. I'm gonna make sure to coil it in my hands just to limit bacteria spread. Now I'm going to take the bag. I'm going to discard of all my materials. I'm going to clean up the bed. Okay. I'm going to cover up the patient, make sure he has some privacy. All right, if you need to let me know about anything, have any questions or concerns, you just let me know. And it looks like we're all done. Bed rails are up. I'm going to put him in the lowest position and we're done.